In this presentation, we will touch on a few of the developmental assessment theories that might be appropriate for use when working with children. As you are aware, I am not a child life specialist, and I have not had any direct experience with working with children with disabilities. However, I wanted to ensure that those of you with a desire and interest in working with children would have some exposure to these theories. Some of the topics presented here have been discussed in the Theories and Therapies presentation as well. In addition, you may have had exposure to this information in other developmental theories in courses throughout your college education. The theory of cognitive development by Vygotsky takes a social, cultural approach to treatment. Vygotsky emphasizes that culture and social factors shape cognitive development. He also placed an emphasis on the role of language in development. He identified 4 elementary mental functions. These 4 elements are attention, sensation, perception, and memory. Piaget is a very well-known theorist that most likely you have studied in your Introduction to Psychology course. Piaget is known for his 4 stages of development. The sensory motor stage runs from birth to 18 to 24 months and focuses on the child's mobility and language development. Stage 2 is the pre-operational stage and stretches from toddlerhood, about 18 to 24 months, to early childhood, about age 7. In pre-operational stage, the child is starting to develop more complex concepts, memories, and imagination. Concrete operational is the next stage and spans from age 7 to 12. Piaget indicated that children in this stage have thinking less about their egocentric and may have become more aware of external events. The final stage is formal operational, and this stage includes children from adolescence through adulthood. Children in the formal operational stage are able to think logically and use symbols to relate to abstract concepts. Parton developed the 4 stages of play. Stage 1 is called solitary play and is characterized by the child playing alone and is either uninterested or unaware of others. The second stage of play is called associative play. In this stage, children appear to be playing together, but the activities are not organized. The third stage is parallel play and occurs when the child plays alongside others, often mimicking the play of others, but does not necessarily interact with the other children. The final stage of play, according to Parton, is cooperative play. In the final stage, the child is interested both in the people playing and the activities. These activities are organized and the participants have assigned roles. Bronfenbrenner authored the ecological systems approach to development. This theory focuses on the impact the environment plays on the growth and development of the individual. According to Bronfenbrenner, there are 5 environmental factors that need to be considered within this theory. The microsystem refers to the environment in which the individual lives. This includes the family, the peers, the neighbors, the schools, and anyone the individual has regular interactions with. The mesosystem refocuses on the interactions between microsystems. For example, the experiences at home and their relationship to the child's experiences at school. The exosystem is defined as where the individual plays no role in the construction of the experience, but the experience has a direct impact on the individual's microsystem. For example, the primary provider for the family is laid off from work. The macrosystem is influenced by the culture and society in which the person lives, such as political or religious-based beliefs. And the last factor is called the chronos system. This refers to the cumulative experiences a person has over a course of a lifetime, such as your marriage, children, or divorce. Bandura was discussed in other presentations briefly as well. Bandura is known for the social learning theory that focuses on behavior being learned from the environment through the processes of observing. Bandura was discussed in another presentation briefly as well. Bandura is known for the social learning theory. It focuses on behavior and how it is learned through the process of observational learning. Children observe the people around them, and such as their parents and friends and television characters and teachers, and how these individuals behave. Often children tend to imitate those perceived to be similar to self and typically of the same sex. Skinner was also discussed in a previous presentation. He is known for operant conditioning, which is based on behavioralism. He believed the best way to understand behavior is to look at the causes of an action and its consequences. To understand operant conditioning, one must have an understanding of reinforcement. According to the principles of reinforcement, the behavior which is reinforced tends to be repeated or strengthened. Conversely, the behavior which is not reinforced tends to die out or be extinguished or weakened. Operant conditioning means roughly to change a behavior through the use of reinforcement. Reinforcement must be given after the desired response or behavior is observed. Erikson developed the 8 stages of psychosocial development. Like Bandura and Skinner, Erikson should be a familiar name from previous courses and slides. Stage 1 is called trust versus mistrust and spans from birth to 1 year of age. This stage centers around the development of trust that is based on the dependability and quality of the child's caregiver. Stage 2, titled Anatomy versus Shame and Doubt, spans throughout early childhood. In this stage, children develop a greater sense of personal control as they develop control over their bodily functions. Stage 3 is called Initiative versus Guilt. This includes the preschool years. Children begin to assert power and control over the world through play and interactions. Stage 4, called Industry versus Inferiority, spans from ages 5 to 11. In Stage 4, the child begins to develop a sense of pride in their accomplishments and abilities. Stage 5 is titled Identity versus Confusion and covers the adolescent years. Adolescents develop a sense of self and independence. Stage 6 is called Intimacy versus Isolation and spans through early adulthood, where the individual begins to explore relationships. Stage 7 is called Generivity versus Stagnation and covers the adulthood years, where the individual focuses on family, career, and building a life. The final stage is Stage 8, titled Integrity versus Despair. Stage 8 covers the developmental stage of old age. In Stage 8, people reflect on their life and life events. Bowlby is known for attachment theory. He believed that mental health and behavioral problems can be attributed to early childhood. Children with biologically pre-programmed to form attachments in order to survive, and the quality of these attachments can influence behavior. The main points of attachment theory are that children have an innate need to attach to one main figure. The child needs continuous care from the main figure for the first 2 years of life. Long-term consequences of maternal deprivation include delinquency, reduced intelligence, increased aggression, depression, and/or affectionless psychopathy. And the child's attachment to the main figure leads to the development of an internal working model of their understanding of the world, self, and others. I encourage you to further investigate any of these theories if you are especially interested in working with children, and learn to use these theoretical perspectives when designing and implementing your treatment programs.